Hello. In this presentation, we will be talking about total shoulder arthroplasty and reverse shoulder arthroplasty, as well as the post-op recovery period. Normal anatomy of the shoulder involves the glenohumeral joint, which is the ball and socket joint of the shoulder. There's cartilage that lines both the ball and the socket. The cartilage is there to cushion the impact between the bones. It provides a smooth, gliding surface. The rotator cuff is a group of 4 muscles that are deep inside the shoulder. The rotator cuff attaches onto the greater tuberosity of the humerus. The rotator cuff is responsible for motion such as reaching forward or to the side. Both the deltoid and the rotator cuff are important muscles of the shoulder. Both provide stability as well as strength for elevating the shoulder joint. Arthritis is the breakdown of cartilage, development of bone spurs, and loss of the smooth joint surface of the glenohumeral joint. With the progression of arthritis of the glenohumeral joint, you may be experiencing some of these symptoms. The joint replacement operation will be performed while you are completely asleep. You will be sitting up for the surgery. The incision will be on the front of your shoulder and will be between the deltoid muscle and the pectoralis muscle. It is about 5 inches long. We will begin by releasing the subscapularis tendon in the front of the shoulder as well as reattaching your biceps tendon. We will then look deep inside the shoulder joint at the arthritis and the glenohumeral joint itself. We will then remove the arthritis from the humeral head and place a metal stem down into the shaft of the humerus. We will then look at the glenoid or the socket of the shoulder and replace the arthritis with a plastic socket. If you have a known rotator cuff tear or an abnormally shaped glenoid, we will be performing what's called a reverse shoulder arthroplasty. This is an implant in your shoulder that will function without a rotator cuff. It will use the compressive forces of the deltoid muscle instead. The incision will be the same size and the recovery time is the same for the total shoulder arthroplasty as for the reverse shoulder arthroplasty. People may experience slightly less range of motion with the reverse shoulder arthroplasty with forward flexion and internal rotation. The procedure is the same amount of time and arthritis will still be removed from the humeral head. Notice how the ball and socket have been switched, where the ball is now medial in the shoulder where the socket used to be. After the bony work has been done, we will repair the subscapularis tendon in the front of the shoulder. This repair takes months to heal and is one of the reasons why we protect your shoulder with a shoulder immobilizer for 6 weeks. The incision on the front of your shoulder will be repaired with sutures that are underneath the skin and will dissolve on their own. Your shoulder will have a white bandage on it. This bandage needs to stay in place until your first post-operative appointment. Please keep the incision dry and do not get it wet in the shower to prevent infection. Do not scrub or scratch at the incision or submerge your incision in any pools, hot tubs, or bodies of water. You may have been contacted already about receiving a shoulder immobilizer or sling. You may either use a gray shoulder immobilizer or black sling, depending upon which fits you better. You will be fitted for both of these options. After the surgery, we ask that you wear the sling at all times, including at night while you're sleeping. You may take your arm out of the sling to perform pendulums or work on range of motion of the elbow. We will teach you how to do these things at your first post-op appointment. A lot of patients tell us that it is most comfortable after surgery to sleep in a recliner or in bed with pillows propping you up. You do not have to sleep in a recliner, and if you prefer to sleep flat in bed, you may do so. In order to control your pain after surgery, the anesthesiologist will perform what is called a nerve block. This is where they will make your operative extremity completely numb. If they perform the nerve block, this lasts for about 24 hours after the surgery. Some anesthesiologists, with your permission, will put in a catheter into your shoulder to provide numbing medication, which lasts about 3 days. You will go home with this catheter and remove it on your own if you choose to have this done. We usually prescribe oxycodone for pain management. If you have an allergy or do not tolerate oxycodone, we may prescribe hydrocodone, acetaminophen, for you. We also prescribe an antibiotic following surgery. However, if you stay one night in the hospital, you will be given this antibiotic through your IV and will not require a post-operative prescription. You may need ibuprofen and Tylenol, and we actually recommend that you take this in addition to the narcotic medication. We also recommend that you pick up a stool softener. This can help prevent constipation, as narcotics can make you constipated. We will be writing prescriptions for pain medication at your preoperative appointment. For the first 6 weeks after surgery, you will be wearing your shoulder immobilizer or sling. We will teach you the exercises that you are allowed to perform at your first post-op visit. We want you to wear the sling at all times. You may not take your arm out to move your shoulder forward or to the side. You can take your arm out of the sling to shower or to let your shoulder rest, but we want you to wear it during the day and at night as much as possible. Once you are told by your provider at 6 weeks that you no longer need to use the sling, we will begin stretching exercises. We will teach you these stretches in our office and eventually send most patients to outpatient physical therapy. You may not lift anything more than a couple of pounds or a full cup of coffee away from your body at this time. Lifting close to your body is allowed. We will discuss this in more detail at your post-op visit. Around 3 months from surgery, we will allow you to begin strengthening your shoulder. We will continue to limit the weight that you are allowed to lift away from your body, but most people are performing their normal daily activities at this time. Please read through this list of possible complications that may occur following surgery. Going to sleep with anesthesia comes with its own set of risks. The anesthesiologist will discuss these with you prior to your procedure. We will also discuss your medication list and allergies at your pre-op visit. Prior to surgery, you may have been informed from our office that you need to get some testing done. Blood tests, possible PCP clearance, COVID testing, and an EKG may be performed. We will be following you closely after your surgery for multiple post-operative visits. At some of these visits, we will be checking your range of motion, and some of these visits we will be obtaining x-rays. This surgery has been very successful. Our goals for you following surgery are pain relief, improvement in function, and return of independence. Thank you for listening. If you have any more questions, please write them down and we will be happy to discuss them at your preoperative appointment.